friends, this is Grow with Vani and I am discussing with you about medical profession and practitioner. A medical practitioner, also known as a doctor or physician, is a health professional who studies, diagnoses and treats illnesses and injuries. What are the responsibilities of the medical practitioners? He who relate with medical practitioner, diagnose and treat diseases, infections and injuries. He must promote, maintain and restore health. He must provide care for patients' well-being. Some specialties must be there. Some doctors specialize in a particular area such as pediatrics, psychiatry or surgery. Other works in general practice providing comprehensive care to individuals, families and communities. There are work settings about medical practitioner. There must be hospitals, there must be private practices, public sector organizations such as the prison services, universities and research organizations, the armed forces. What are the education for the medical practitioner? To become a doctor, you need an undergraduate degree, usually in science related field. You also need to take the medical college admission test, MCAT. The examples of medical practitioners are general practitioner, allergist, angiologist, dental surgeon, endodontist, exodontist, flight surgeon, gastroenterologist, sleep medicine specialist. Medical practitioners or doctors and consultants are medical professionals who are tasked with the diagnosis, care and treatment of their patients. Learn more about a career in this field. Find out what it involves and what you will need to study and do to get a role. Medical practitioners are found in hospitals, community clinics, private practices and many other settings. The work is extremely varied and you will have to be comfortable dealing with wide variety of cases. A medical practitioner is someone who tasked with the health care and their patients and has the medical knowledge to provide them with the best advice and treatment to suit their needs. After training, medical practitioners will often go into senior roles where they care for patients and manage other healthcare professionals. There are daily tasks. It will vary but could involve speaking to patients face to face, diagnosing symptoms, training juniors and other professionals, researching to improve and maintain their knowledge and practice, prescribing medicines and recommending treatments to the patients, helping to train doctors, working with healthcare professionals. A general practitioner focuses on your overall physical and mental health. They are often also called family doctors or internists, but there is a slight difference. General practitioners who aren't certified by the Board of Family Medicines can't call themselves family doctors. For the same reason, general practitioners who don't have a board certification in internal medicine can't call themselves internists. That said, many family doctors and internists do practice as general practitioners or GPs. At any life stage, your general practitioner can be the first contact in helping you care for your overall physical and mental health. GPs often develop an ongoing relationships with you, providing continuity of care. They treat common medical conditions and perform routine exams. They refer you to other medical services or doctors if you need urgent or specialized treatment. Medicine is the science that deals with diseases in humans and animals. The best ways to prevent diseases and the best ways to return to a healthy condition. People who practice medicine are most often called medical doctors or physicians. Often doctors work closely with nurses and many other types of health care professionals. Many doctors specialize in one kind of medical work. For example, pediatrics is the medical specialty about the health of children. In this specialty, the doctor is trained to provide anesthesia and sedation. This is important for surgeries and certain medical procedures. Anesthesiologists also provide pre-operative assessments, ensuring the patient is safe during operation and successfully awakens from anesthesia after the operation. They assess for medical conditions and suitability for anesthesia. They screen for risk factors prior to surgery and try to optimize the operative environment for the patient and the surgeon. They are the doctors who give epidurals during labor and delivery, provide spinal blocks, local nerve blocks, and general anesthesia for procedures. They are the doctors who are especially trained in intubation, putting a tube into the lungs to help a person artificially breathe when the person is paralyzed and asleep during surgery. Hence, due to their skill in intubation, they are often the first line responders for emergency. They help people who are in distress with their breathing, who have lost their airway or when their airway has become obstructed. A cardiologist is a doctor with special training on the heart. The doctor in this field ensures the heart is healthy and functions properly. The heart is a vital organ whose role is to pump blood to the rest of the body. The purpose of blood is to deliver oxygen to the tissues. Without the heart functioning well, our tissues and organs would die and not function properly. Cardiologists trial and treat heart attacks, sudden cardiac arrests, arrhythmias, and heart failure, many of the heart-related illnesses. They specialize in life-saving procedures like cardiac stents and cardiac ablation. There is a subspecialty within cardiology called interventional cardiology. These are cardiologists who specialize in interventions or procedures to save the function of the heart, such as cardiac stenting or angiography. What is cardiovascular surgery? This specially consists of well-trained doctors who practice cardiac surgery. They are best known for their role in cardiac bypass surgeries. In cardiac bypass, the surgeon restores blood flow to the area of the heart that was deficient due to a blocked coronary artery. This is usually done by taking a vein, most commonly the saphenous vein from the leg, to create a pathway of blood flow to the heart region that needs it. The emergency medicine. Emergency room doctors are in charge of sudden, important or life-threatening emergencies. In addition to dealing with heart attacks, strokes, traumas, issues that require immediate medical attention or surgeries, they also deal with a wide range of other health conditions. Their training is broad and diverse as anyone can walk through the door seeking help. They see patients of all ages and walks of life. However, unlike a general practitioner or family doctor, their immediate goal is to make sure the patient is stable and exclude any serious or life-threatening disease or conditions. The family medicine. What is that? A family doctor, or otherwise known as general practitioner, is trained to provide medical service to people of all ages, demographics, and walks of life. Their training is diverse to deal with a variety of conditions, including all non-surgical specialties. They also follow the patient from birth to death and are trained to treat an individual as a whole in the context of their social setting and also their family situation and mental health. Unlike specialists who mainly deal with problems of one organ or system, family doctors deal with all parts of the body and synthesize the information for the patient's general health. They provide a global perspective of the person's health in the patient's unique life situation. They are an individual's regular doctor who knows the patient in their social and family context. They can refer to specialists for issues that require more detailed or specialized treatments unavailable to them as an outpatient or beyond their expertise. Gastroenterology. Gastroenterologists are doctors who specialize in the gastrointestinal, GI tract and upper abdominal organs. The GI tract consists of the esophagus all the way down to the anus. The upper abdominal organs include the liver, gallbladder, pancreas, and spleen. In addition to dealing with medical conditions associated with these organs, doctors in this specialty also perform endoscopies. This is where a camera is placed to visualize the esophagus and stomach, upper endoscopy, or the colon, lower endoscopy or colonoscopy. Gastroenterologist that specialize in the liver is called a hepatologist. They are responsible for treating patients with liver failure or cirrhosis. They also treat patients with viral hepatitis A, B, C and many other forms of liver disease. There is internal medicine. Doctors in this specialty are trained to recognize and treat a variety of different conditions involving the internal organs. They have wide knowledge in a number of specialties including but not limited to respirology, nephrology, gastroenterology, cardiology. Doctors who practice broadly in this field are known as generally internists or general internal medicine doctors. Internists can go to receive further training beyond residency in a particular field. For example, gastroenterologists are internists that have chosen to specialize in GI medicine. Internal medicine doctors are in charge of inpatient units when patients are admitted for a general reason. Unlike family doctors and emergency doctors, although their training is diverse and they have broad knowledge in many organ systems, they do not treat or manage children, babies or pregnant women. Gynecology and obstetrics. Doctors in this field, abbreviated OBGYN or OBSGyn, specialize in women's health covering conditions of the female reproductive organs and pregnancy care and delivery. Some examples of gynecological issues they deal with include fertility workup and treatments, prolapse and incontinence, ovarian tumors, cysts, gynecology, oncology. They are also surgeons in their fields capable of performing numerous gynecological surgeries. Doctors in this field also practice obstetrical medicine, specializing in maternal fetal care and deliveries. Complications related to deliveries, assisted deliveries such as vacuum and forceps deliveries, and cesarean sections. Ophthalmology. This medical specialty consists of well-trained doctors who recognize and treat medical conditions associated with the eyes. Some common complaints they see include red eye pain, visual changes, and trauma. They deal with many eye diseases including conjunctivitis, iritis, blepharitis, rhodolium, chalazion, glaucoma, cataracts, macular degeneration, retinal detachments, papilledema, central retinary artery occlusion. They are trained to perform surgery. Otolaryngology. These are doctors with special training to treat the ears, nose and throat. These are the doctors who will very commonly remove an organ called the tonsils from a patient. Pulmonary. This medical specialty, commonly known as chest medicine or respiratory medicine, deals with respiratory system. It usually involves patients who require intensive care, including life support and mechanical ventilation. Doctors of this field usually are knowledgeable in diseases and conditions of the chest, such as pneumonia or asthma. Doctors in this field tend to perform minor procedures in surgery of the respiratory tract. Pulmonary specialists often practice critical care medicine. They also manage complicated chest infections.